and my name is Jess Holm. I have been a nurse midwife since 2008. I have been a midwife at Hennepin Healthcare since 2013. I work out of the Women's Health and Wellness Clinic, which is in the Clinic and Specialty Center of Hennepin Healthcare. That's downtown Minneapolis on 8th Street. The best part of my job is getting the opportunity and being trusted with the opportunity to be with patients through the most amazing and also some of the most mundane parts of their lives. So childbirth is something that people really never forget, even if they've had 10 kids. And I feel honored every single time I have the opportunity to be trusted to be with people when they give birth. I also love being trusted to talk with people about their family planning options or their infections that they're coming in to be seen for, or their mammograms and their breast cancer screening. In addition to being a clinical midwife, I am the service director for the Nurse Midwife Service and the Nurse Midwife Division here at Hennepin Healthcare. The best part of my job as the service director is leading the amazing team of 20 midwives, 19 other than me at this institution. We have a group of the most caring, dedicated, and hardworking midwives in the world, but I can definitely say nationally. If world is too big, we have a group of midwives who have anywhere from 2 years experience to 22 years experience, and they come from different countries around the globe and different states, different training programs. We have different experiences, but we're all here to help each person who trusts us to have the best outcome possible. I love being a midwife because being a midwife means being with women. That's what the word midwife means. It's from the Old English, mid, with, wife, woman. Now, we take care of people who don't identify as women, but they might have a uterus and they might be pregnant and giving birth. So I'd like to acknowledge that, but still, just being a midwife means that I am here to be with woman or with the person who is coming to care for me. And that is exactly what I want to do. I love connecting with someone and finding out what their healthcare goals are and what their family's healthcare goals are, and then doing what I can to provide information, support, and advocacy to help them achieve those goals. Hennepin Healthcare was the first site that allowed for hospital-based nurse midwifery practice in the state of Minnesota. Our service started in 1971, and we've been providing continuous high-quality care since that time. So that history to me is important. I've learned a lot from my foremothers, and I am really happy to be a part of the current practice and where we're going in the future. The other part about working at Hennepin Healthcare as a midwife is that I have the opportunity to meet people and work for people and care for people who I wouldn't meet in my regular life. I meet people who have just arrived in our country. I meet people who grew up in places totally different than I did. I meet people who speak languages that I may have never heard of. I hope that I can be a welcoming individual for people regardless of where they come from, what language they speak, who they are, how much money they make.